When you feel uncomfortable and go to the hospital, will you choose traditional Chinese medicine or Western medicine? Why do people often say that traditional Chinese medicine cures the root cause, while Western medicine can cure the symptoms more quickly? What are their respective strengths? In fact, traditional Chinese medicine and Western medicine are two sets of theories for the same human medical phenomenon. In the process of practice, TSM treatment is noted for its concept of holism and treatment based on syndrome differentiation, while Western medicine looks for the cause of disease and then uses appropriate medicine according to the human body's physiological systems. For instance, Chinese medical theory does not have the concept of a nervous system. However, it has been proved that neurological diseases can be treated by Chinese medicine. In Western medicine, wind is not a pathogenic factor, yet Western medicine is able to treat wind rash, rubella, and wind arthralgia distinguished by TCM. The traditional theories underlying the two medical systems are different, but both can cure the same disease. In the two theoretical systems of medicine, the logic and thinking that guide the doctor's clinical diagnosis and treatment are radically different. The two different ways of understanding produce two very different theoretical systems and methodologies. The Western physician directs his attention to categories and causes of isolatable diseases. Regarding them as targets, the Western physician isolates, changes, controls, or destroys these diseases. The Western physician starts with a clinical symptom, and then, through careful checkup and laboratory examinations, searches for the underlying mechanism, a precise cause for a specific disease. Precise diagnosis frames an exact quantifiable prescription for the disease. Compared with the Western physician, the TSM physician is more concerned with a person's total condition. Observation plays an essential part in the Chinese physician's diagnosis. Everything about the person is observed: tongue, eyes, skin color, hearing, pulse, age, weight, body type, voice, hair, posture, and body odor. The TSM physician collects all the relevant information, symptoms, and other factors related to the patient, such as living environment, weather, habits, moods, etc., and weaves them into what TSM calls a pattern of disharmony. Such a pattern is in fact a description of the imbalance in the patient's body, and a prescription is rendered to regulate the imbalance. In the process of syndrome differentiation and treatment, the most frequently used is the theory of visceral manifestation in traditional Chinese medicine. After collecting all kinds of information about the patient's condition, we shall be able to connect it with the psychological function of his internal organs, and finally we can treat him more effectively. This is also one of the biggest differences between Chinese and Western medicine. The theory of visceral manifestation in traditional Chinese medicine is more reflected in its unique functional state rather than just staying at the visual material level. It's described in the discussion of secret classic in Ganoderma and House in the Planck questions. Heart is the monarch, thoughts get out there, the lungs are the premier, controls and adjustments get out there. The liver is general, strategies get out there. The gallbladder is the upright judiciary official, decisions get out there. The pericardium is the herald official, joys and sadness get out there. The spleen and stomach are the garner officials, the five flavors get out there. The large intestine is the transportation official, changes get out there. The small intestine is the reception official. Digestion gets out there. The kidneys are the power official. Skills get out there. The triple warmer is the water administration official. Water networks get out there. The bladder is the water reservation official. Fluids are stored there and wastewater is discharged after transformation. Traditional Chinese medicine analyzes and summarizes the characteristics of patients' symptoms, and then summarizes which part of the viscera has abnormal function. It must be noted that the visceral system of traditional Chinese medicine are more of a metaphysical functional state. For example, the spleen of traditional Chinese medicine includes the whole digestive function and has become the center of the visceral system of the human body. The heart is not only a blood supply organ, but also a hiding place for spirit. The Chinese physician looks for and organizes symptoms and signs, which are not noticed by the Western physician, and then uses them to distinguish various patterns of disharmony. The Western physician regards such disharmonies as the same type of disease. To Western medicine, understanding a disease means perceiving a distinct entity that is isolatable from the patient's body. Whereas to TCM, understanding means finding correlation between all the patient's symptoms and signs. It is necessary to integrate the symptoms as well as other aspects of his or her life and behavior so as to determine the type of disease. Just as the saying goes, no matter black or white cats, as long as they can catch mice, they are good cats. Why should we set Chinese and Western medicine against each other and let them fight each other in the process of comparison? Let them cooperate with each other and better serve human health will be a rational choice. As the world has seen at present, traditional Chinese medicine is indeed more effective and safer than Western medicine in the conditioning of some chronic diseases. But at the same time, due to its own disciplinary characteristics, traditional Chinese medicine is not as fast and timely as Western medicine for some acute diseases such as major trauma and shock. If the experimental method of Western medicine can prove more internal mechanism of traditional Chinese medicine so as to achieve the purpose of popularization and universality, the concept of holism in traditional Chinese medicine and the thought of syndrome differentiation and treatment can inspire Western medicine to regulate the dynamics of the body from the overall situation rather than just limited to a corner in the struggle between human beings and diseases. Traditional Chinese medicine and Western medicine can fight side by side with complementary advantages.